Everybody, hi there.
Would you like to sign our sign-up form and get you something to eat?
Yeah, I grabbed some food.
Some wine and snacks and I understand.
I had 50 people RSVP, so we might need to get more chairs in here. No, I'm kidding. That'd be nice.
Well, I think we had 6 or 7.
Yeah.
Yeah. It's great turnout. I'm super appreciative.
Yeah, for sure. I don't think I know you.
Yeah, Dan Deacon.
Dan, okay.
Yeah.
Brian Murphy. Nice to meet you, Dan.
Good to see you.
Yes. Jeff told me you'd be coming.
Oh, yeah.
Invitation by invitation.
Yeah, he knows I need help.
Yeah, okay.
Dan told me about it earlier.
Yes, yeah.
Somewhere or another, we all
Admitting it is the first step. How are you?
Hey, Doc. Good to see you.
Good to see you. Yes.
Been a while.
Yes, it has. How have you been?
Good.
Good.
Not too good. Or
Not too good. Yeah, you're right. Exactly. Exactly. Well, we'll go ahead. I don't think we're expecting anyone else. And
Angela?
if they roll through, we can let them just kind of grab some food and help yourselves to anything.
Well, it's delicious, thank you.
Yes, you're welcome. My pleasure. My
So
pleasure.
You're kind of far over.
Oh yeah. Okay. Yeah. I've got to be in the. Let me get my
We use them
mouse.
for our website too. So.
Yeah. So obviously everyone's here to maybe find out hopefully a little bit more information about shoulder pain. I'm going to share some tips with you on ways that I've found clinically to help patients get rid of their shoulder pain and also get them back to doing activities that may be limited. Okay? So what do all people who have pain want?
We can last.
Yes. Doesn't interfere with your quality of life. Trying not to rely on medications if possible is another one I commonly hear frequently. Avoiding surgery and injections, that's kind of an obvious one. An explanation. What's going on? My shoulder's bothering me. I have pain. I can't do something. What's the problem? And a plan. This is the approach we're going to take to try to get it better. What do I need to do to get it better? So some of the things that maybe you've already tried in dealing with shoulder issues, medications, of course, injections, maybe, physical therapy, a brace, a sling, ice, heat. I didn't put prayer on there. Massage. Okay, so obviously a lot of different things that you can try to do, some effective, some maybe not effective. Is it getting you to the end goal, which is pain reduction, and I don't want to be limited in the activities that I choose to do? So explaining shoulder pain, why is the shoulder so important? Well, it's fairly intuitive. I mean, your hand is the mechanism you use to interact with the world. The shoulder is what gets your hand where it's going, okay? So if the shoulder is causing pain, that's oftentimes limited in reaching, grabbing, shirt on and off, washing hair, putting on makeup, putting on your belt, tucking in your shirt. So it's kind of like there's a lot of kind of daily functional limitations that happen. So it's annoying, and it can be debilitating. Outside, so where is that pain coming from? Outside of a traumatic event to the shoulder, I've fallen on the ice, I've landed on my shoulder, I've done something really bad, I know it because I can't lift my arm, and that's fairly intuitive. Outside of that, we see a lot of different problems in the shoulder. Rotator cuff are the muscles that attach to the shoulder. Those they can have tears, they can get tendinitis, they can just get agitated, okay? We see also impingement. These are just kind of maybe some of the terms you've already been told. bursitis, labral tear, which is the cartilage that sits in the shoulder. Okay, so a lot of possible injuries that could be contributing to the pain or might not be contributing to the pain. What can you do? So that's where I'm going to share with you the tips to hopefully help you avoid having to get the x-ray, get the MRI, do something more invasive. So tip number 1, warm up your shoulder before you do something important, okay? This one, how many tennis, pickleball, any golfers, golf, yes, tennis, using the old bike, riding a bike. Oh yeah. The old chopper. You don't have one of those choppers where you got to put your arms up here, do you?
Not that high.
Not that high. Okay, but up there. Yeah. So yeah, imagine that one like this. You're like, oh man, my shoulder's killing me. So it's, we used to be able to get away with maybe not having to warm up before we go out and play or before we go out and do some kind of activity. As we age, that just gets more important. And you just have to admit that to yourself. That and what do I do to warm up? Well, that's a logical question. So one of the things you can do, because the shoulder is a ball and socket joint, and it really does rely on a lot of the muscles to provide stability to the shoulder joint, warming up those muscles and moving your shoulder in a pain-free way is a good idea to do before you go play golf, before you go play pickleball, before you go ride the bike. It's also attached to your neck, to your upper back, and those areas are really important too to kind of warm up as well. Okay. I'll show you a movement, and I'm going to share this presentation with all you guys, so we don't have to do it today. You can practice it. Having the shoulder in a fairly functional position for like a golfer or a pickleball player or a tennis player is a good place to start. So like an athletic stance, the elbow is going to be at the height of the shoulder, and then you're going to be rotating back, okay, repetitively. Now, if that causes pain, there can be alternative positions that kind of elbow more in a protected position at your side, where you're doing some rotation, and it's a ball and socket joint. So if you've been maybe at the office all day, you've been in a static position, and then you're going to take the shoulder from, I've been very static, to now I'm going to bring it through a full range of motion. You can't go from 0 to hero, okay? Priming it a little bit is a good idea to do before you do those more functional activities. And it'll tell you something. Oh, man, that causes pain. Is it the best idea to go play 3 hours of tennis? Maybe not. It's a give and take. So that's one that you can try as kind of a warm-up. If it causes pain, try it at the lower angle, okay? But some kind of warm-up is really the critical part. So tip number 2, the pendulum exercise, it creates some distraction of the shoulder joint. With it being a ball and socket, if you can imagine, the socket is very small. The ball of your upper arm, of your humerus, is very big, okay? So by doing this motion that I'm going to show you in a second, we create, this makes it look bad, but we're creating some kind of pulling apart stress to the shoulder, and oftentimes distraction of joints really is good to help reduce pain, to help improve range of motion. So this is a good one where, man, my shoulder's killing me. I can't go reach for medication. I've left my ice pack at home. What can I do right now to try to reduce some discomfort? And I mean, 9 times out of 10, pendulum is a go-to of like, man, that feels so good. My shoulder, it gives me some reprieve. Okay, so I'm going to see if this YouTube video works. If not, I can just demonstrate it. Man, look at that. Oh, okay, now we've got to get the audio up. And I wonder if that's on this or if that's on this. And that radiates down your arm. It's called a pendulum. You're going to take a 5-pound weight or some kind of object at your home or office that has a little weight to it. Say it's my left arm that's bothering me. You're going to support your right arm on a table or a tabletop. You're going to let the left arm relax and dangle down. You're going to be moving your pelvis in a circular motion, and just let that arm be very relaxed and let it kind of follow the rhythm of your pelvis. You're going to turn pelvis clockwise and counterclockwise. You're going to do 10 times each direction. This, in my clinical practice, has been a really great exercise to give patients who have shoulder pain. It's something that you can do 20 times a day if you really feel like it's benefiting you. Give this one a try to help reduce your own shoulder pain. That play in the background. So that's a most people have some kind of weight. It doesn't have to be a dumbbell, but it could be just anything that you have that has some weight to it, and then just like literally bending over and just letting that shoulder be distracted. And then really you don't want to do the motion just with the arm. You're kind of doing the motion with the hips, and the arm is just very passive and relaxed. Okay.
So that's pulling the joint away from that?
It's pulling the joint away from, it's pulling the joint apart, yeah.
Stretch it or just
It helps. There's a tissue structure called the capsule of the shoulder, and that helps to stretch the capsule. And oftentimes, because the shoulder joint, there's already not a lot of space in there because of just its normal anatomy. Giving it space, it loves it. It's just like, oh my gosh, this is the best thing ever. It just feels really good. Because oftentimes, it's a space issue that you're dealing with already. Impingement. It's just like there's inflammation in there, and there's just not a lot of space, and it needs to calm down. So this is a good way to calm it down. That's a good question.
Is it normal to have shoulder pain, or is it normal when you have shoulder pain, that the pain will go down in your biceps, triceps, or your back?
Yeah. We call that referred pain. So pain that originates from one area that can travel to another. We know that the best example of that is like a heart attack. You know, it's coming from your heart, but you get jaw pain, you get shoulder pain, you get kind of tightness in your chest. So it is common. That is a common pattern to get referred pain that's actually originating from the shoulder, but you may feel it down the arm, on the outer part of the arm, sometimes in the pec. Yeah.
You feel that in the neck also?
You can feel it in the neck. Yeah, a lot of the muscles. That's where looking at the attachment sites of, like, obviously shoulders connected to your neck, and there's some muscles that interconnect those two areas, and those muscles will do a really good job of kind of guarding and protecting the shoulder. It's just your body's mechanism of like, okay, we know what to do. We're going to splint everything. We're going to hopefully help you not use the arm. Obviously, that's not very functional, but in the short term, it's fairly effective. You're like, man, I can't use my arm because it's so tight up here. Yeah, so that's a typical, that's another presentation that we see very often. Yep. Sleeping. Yeah. Everyone's shaking their head. Yep. Mm-hmm. Uh-huh. Yeah, sleeping on that arm is like a guarantee. There's not a single patient who has shoulder pain that doesn't tell me that they have some issue with sleeping on that side. And that's very annoying for some people because they sleep on their side and on that shoulder. So this can be challenging because we're so used to the positions that we sleep in, and like to try to change that, even if it means to reduce the shoulder pain, to say don't sleep on your shoulder is like, okay, yeah, good luck, right? But if you wedge yourself in and put your arm and shoulder in a position where there's the least amount of stress and strain on the shoulder, that's a nice kind of middle ground where you're at least seeing if it helps, right? You may find it's the best thing ever, and then you're going to be like, man, I'm going to sleep like that every night. Doesn't matter if it's not convenient. You'll do it. So this is another one where I've got, and it's called the open pack position of the shoulder. It's if you've seen people who've had shoulder surgeries, they wear a big, huge sling, okay? There's a reason for that sling, okay? Putting it in the position that it's in. It's like the least, they call it the open pack position. It's the position of the shoulder where there's the least amount of strain. So after you've had surgery, they put you in that so you don't move and screw up what the surgeon did, and so it can kind of start to recover. So we're almost mimicking the position of being in a sling, but doing it at night. Okay, so.
In multiple sclerosis, an unknown trigger causes the immune cells to...
Hold on a second. That other video is playing in the background. Now the muting doesn't work. We'll go back. This was part of my intro to acting as well. So I want to make sure we all can appreciate the quality of the acting. It was my first career. Complaint that people tell me all the time with shoulder pain is sleeping position at night. They can't sleep on that arm. It's hard for them to get comfortable. So a suggestion that I have is positioning in bed and finding an optimum position for your shoulder so that it doesn't cause you pain. Basically, say it's my right arm. You'll be laying on your back. If you have a tendency to roll to either side, say the right side or the left, you could use a long pillow and prop it along your side, so that would prevent you from rolling to your left or respectively rolling to your right. And another position that's really good for the shoulder is getting a little pillow underneath your arm and getting it into a position where you can let your hand rest on your stomach. There's what's called the open pack position of the shoulder, and it's the position of the shoulder that stresses the shoulder joint very minimally. And this is actually the open pack position. Your arm has to be away from your body a little bit, your hand resting on your stomach, and the arm angled out slightly as you're seeing it here. So you can either use a little pillow like this, roll up a beach towel, and get the arm into that position, and that's where you're really going to be able to find some comfort. And now you're in a position where you're not going to be able to lay on your side, and the shoulder is well supported. So give that a try and see if that helps you with your sleeping pain at night. That's one that I've had a few patients just like, that's a game changer. You know, thank you for that. That was a kind of a quick fix, and it starts it in the right direction. Because I mean, that's sometimes hope is the best thing we can get. Like, when is this damn thing going to get better? You know, like, okay, try this, and we start to see some hope early on, and then it's like, okay, life's going to be okay. We're going to get past this. You know, move on.
So if you're laying flat on your back, I've always wondered whether it's straighten it out. It's totally like that. That's probably the worst thing to do versus bent is much better.
Bent is better,
Okay.
yeah. Bent is better, and then just even just kind of like hand on the stomach is kind of and really honestly, sometimes nuances of those little positions, like, play with it. You know, it's a one size fits all is not going to work for everybody, but somewhere along that line, you might hit pay dirt.
I can't hardly sleep on my back. And so
Okay.
I tend to lay on the shoulder that hurts. I don't know how to, I mean, do you lay on the other shoulder?
You could, yeah.
Which is possible?
Yes, just depending on how severe, you know.
Try to stay off of it.
In the short term, yes, not forever. Yeah. So I mean, it's kind of like I'll take my medicine now, kind of, you know, I'll try this now, but I know it's going to get better with, you know, some other things. But it is hard. Yeah. That's one that's like some people are just like, I don't want to try it because I'm so used to sleeping in one position, you know. Okay, so I've got to give myself a shameless plug, of course. Having an assessment from someone that understands this kind of regional interdependence, what we call, it's called regional interdependence, the neck and the shoulder and your upper back and the shoulder blade, your collarbone, how all of those things interact. And maybe oftentimes I find that there are other, what I call impairments, than just where the pain's located, right? Stiffness in the upper back. Well, we know clinically, and research shows it, that stiffness in the upper back will prevent the shoulder from going through its normal motions, and it will make the shoulder work harder. So if you don't address the stiffness in the upper back, you're treating symptoms and you're not getting to the cause of why the problem's there. And that's not good. It can be complicated, and it takes time to investigate where the problems are. But you've got to have somebody that can kind of look at it from that holistic model, or else you're just going to put a Band-Aid on it. It's going to get better maybe in the short term, but then it's going to come right back. We know that prior injury, prior pain is a predictor of future pain. So sadly, you're going to be at a higher risk, even if it resolves. You're going to have a tendency to have an issue there if you don't continue to do the things that are recommended based on your specific limitations. Oh, your neck, you've got some stiffness in your neck, you've got some stiffness in your upper back. It's like, this is how we attack those things, and if you don't want to see me again, you should keep doing these things. Because that, to me, is where there's a lot of value. I mean, patients probably don't believe me when I say it. I don't want to see you again. I want to have you have some ownership over it, understand what you need to do, go do it, and tell me how great things are. And then go tell a friend. Yeah, that's kind of the ideal approach. So, tip number 5, and this is really, it's not necessarily, it goes along the lines of what I just said of like, are we asking the questions that need to be asked to find the root cause, or are we treating symptoms? Easy to treat symptoms, don't get me wrong. Like, hey man, I'll pop an Advil and feel better, versus I gotta go see Brian again and do all these exercises and all this other stuff. But it's like, is which one's gonna get you the end goal, even though it might take a little more effort? And of course, there's side effects of oral medication. I'm not poo-pooing on medication or surgeries or injections. I mean, if they're needed, great, but it shouldn't be the first line of defense, in my opinion. We talked about very little space in the shoulder. We talked about once it gets agitated, passive treatment is oftentimes not gonna No active person wants to be told anyway, like, hey, don't golf for 6 weeks. Don't go ride your motorcycle for 6 weeks. Like, no, I'm not going to do that. That's not, and oftentimes that's not needed, but there might be some contingencies of, hey, let's pull this away, let's try this, or let's modify. Environment can be a big part of it. So, why you're still struggling with the shoulder pain. I'm sure we've all tried some things. Maybe we got an invite here tonight. It's like, hey, this guy might know what he's talking about. Come on out and see if he can help you. After everything you've tried, why are you still allowing shoulder pain to kind of dictate some of the things that you find enjoyable? Well, you're in luck. You're here for a reason. Maybe it was, an invite. Maybe it was divine intervention. I've just treated a lot of patients with shoulder issues, and like this individualized approach is just, in my opinion, what is needed and should be afforded to every patient, because every person's got a unique story. Injury history we talked about. How long's your pain been there? What have you tried already? What are your desires and your goals and your hopes? That's going to be different for all of us, right? So if that's not taken into account, and there's not this kind of like therapeutic, like we're in this together kind of feel, I don't know. I think that's less of an opportunity than there could have been afforded when you're dealing with like healthcare, in my opinion, just overall. Unique symptoms, we talked about that, and just getting back to enjoying quality of life, basic things. You know, I just want to be able to sleep on my shoulder again without pain waking up, you know. It's like, is that too much to ask? I don't think so. So a couple options that I use what's called a discovery visit. You may think I'm FOS. If you do, this is like a lower entry point to say, okay, I'm going to ask Brian specifically about my concerns and let him tell me what he thinks is going to be helpful. And it's $25. And I spend about 30 minutes with you, maybe even a little bit longer. I screen you through a few movements. I ask you these questions. You ask me some questions. Hey, Brian, I've tried PT before. What are you going to do different? Hey, Brian, I've had an injection in my shoulder. What does that mean? Do you think I can get better? I've had this for 8 months. Okay, I can answer specifically those questions based on your own unique circumstance. Okay, and I do that. I mean, I have an office. I've been here for 4 years. I have an office offsite that I've had for 5 years, and I just love working with active people, honestly. And the members here I've really enjoyed it, and I think most of them would say that I've helped them in some way, I hope.
They do.
They do. Oh,
Very good reputation.
oh, good. Oh, thank you. yeah. And I've had people tell me that, and it's good to hear, you know, because I enjoy what I do, and I'm glad I can help people, you know, stay active and just enjoy the things that this club has to offer. I mean, this is a fantastic club. It really is. And if you're not with your people, and you're like, man, I can't go play pickleball tonight, or I can't go golf because I'm dealing with this, like that's not fun. So that's option one. If you are gung-ho, I can do an assessment with you, and this is where I actually go in, look at everything: neck, shoulder, upper back, low back, hips, knees, foot, ankle. What other prior injury history do you have? I mean, we're talking about shoulder, but how many people here have had more than one injury? Everyone, right? Yeah. So it's like, what maybe might be rumbling underneath that, hey, while the getting's good, you're motivated, let's just knock that out too. So normally that's $250. I spend about 75 minutes to 90 minutes because it takes that long to go through your history, assess you, move you around. I don't just tell you what's wrong and then not do some treatment with you, because I've found clinically that a patient that I can impart change on in that first visit, they're very bought in. Brian, when I do this, it hurts my shoulder. I do my little magic, hands-on stuff, and then you reach again and your shoulder feels better. Like, that's a person that's like, they're ready to write a check. You know, they're ready to say, oh yeah, okay, this guy knows what he's doing. So I don't just tell you what's wrong and then not do some kind of treatment with you on that first visit. It then also allows me to be very when I'm thorough and assess your everything, then I can say, this is the plan and the approach that I would recommend that we go through to kind of attack this, this, and this to get you back to doing riding the bike, sleeping on your side, playing golf, hanging out with your buddies, like whatever kind of the story is. I'm sure I'll get a question about insurance, so I'll just say it now. I deal with some insurances as an in-network provider, and I deal with some as an out-of-network provider. So if that's a specific question that you have, I can kind of discuss that with you individually. And look, I'm very transparent. I don't want there to be like, hey, you owe me this 6 weeks down the road. You're not going to like that, and I've broken trust with you, so I don't do that. I try to be as I am as transparent as I can be up front. We just gather the information, I lay it on the table, and you say, hey, I think I'm good, or hey, I think I've got a problem with this, let's talk about it. I like to solve problems. So, I mean, if there's concerns, let's put it on the table, let's talk about it, let's be okay with both being adults and agreeing to this situation, and then we're good. Or, hey, Brian, I don't think I'm comfortable with that. And I can say, hey, well, why don't you try this? And I'm not just going to be like, get the hell out of here. Yeah. I'm going to say, try this or go somewhere else and let me follow back up with you. Okay? Did that get you the outcome you were looking for, which is what you deserve? So, so these options are obviously for people who have shoulder issues and maybe don't want to try something more invasive, or they've already tried something invasive and it hasn't gotten the job done. If you're interested, I'm going to be hanging out, so you can talk to me directly. On the next slide, I'm going to have my phone number, email. You can call, text, email me. I'm here kind of by appointment. I float around through the fitness center if I'm here seeing members. But then I'm back between my other office too. So probably the best way is to try to just set up a time where I can coordinate schedules with you. Then we have designated time versus like we're passing in the wind because I'm always running somewhere. So I'm here in the fitness center. That is my office number. If you call it, you will talk with Denise, my patient care coordinator. She's fantastic. She'll ask you a bunch of questions. That'll kind of already start, and she shares that information with me. That already starts me on the hunt of what's the problem. But certainly she can help facilitate us getting together, or you can shoot me an email directly. That's my email, and I always respond to my email. So, and text, you can text that number as well. And either I will respond to it or Denise will respond to it. Any questions?
I have a question.
Yes, sir.
I've had 3 shoulder surgeries, and after the last one, I came to you.
Yeah.
We got it taken care of. I didn't have any problem probably for 2 or 3 years.
How much do I owe you again? No, I'm kidding.
And about 2 months ago, maybe a month and a half ago, I started having shoulder pain again.
Okay.
Same thing as before, when
Yeah.
you lift your arm out front,
Yeah.
you know, you got
Yes,
some pain.
yeah.
I can sleep on the right side without it hurting my
Yeah.
shoulder.
Yeah.
And I'm wondering, is that a common occurrence that somebody recovers from a surgery and doesn't have any difficulty for several years and then starts having some issue? Is that common, or is that just an old man?
Right. Yeah. Is that an old man problem? It really, depending on what you've asked yourself to do after that surgery, it probably has dictated some of that. You know, did you pick up,
I haven't
change much of anything? Yeah. Some of this stuff, just bluntly, is you're aging.
Yeah.
Sadly, all of us are aging, right? And what I said earlier of prior injury is a predictor of future potential problems. I mean, that's just a fact. No one in sports medicine or orthopedics would argue with that. We argue about a lot of stuff, but that is one thing that you'd get a consensus statement on. 50 people in the room, they would all agree with that statement. So with the fact, 2 or 3 years is actually pretty damn good for post-third shoulder surgery. And you've had success in the past, so I like to think of glass half full. Chances are it's going to go well again. Like doing something about it, of course, is going to help that process. But yeah. But it's not to say, you know, that's probably how I would answer it without giving you too many details.
Well, that pendulum deal helped before.
Yeah. Does it help?
I forgot about it.
Oh, okay. Oh, good. Okay. Oh, great.
So I'm gonna try it again.
Heck yeah. Hey, if you don't have to call me, great. Serious. I mean, honestly. Jeff.
Those 2 exercises, you can do those on a daily basis, or are you recommending them maybe only like if you're going out to play golf too prior?
Yeah, the one being more of the warm-up, I would say prior to activity. Yeah, the kind of the shoulder. Yeah, and that really is kind of a more functional one for a golfer, just because like right-handed golfer sets the club at the top of the backswing. Looks pretty much like that exercise, so pretty functional. And then the second one is more for the situation like I need to try something to get some reprieve on this shoulder. Let me try the pendulum. Oh, wow, that's great. It works. Hell, I have people bringing their weights with them on vacation to the office. They put it, they put it on their nightstand. They trip over it and they pick it up. And, if it works, use it in that situation for the pendulum. Yeah. Pain relief. Yeah. With that one being the goal. Shoulders fun. I like to treat shoulders. It's a cool joint. I mean, it really is. I mean, like when I look and invest, we all have stiffness. I mean, hell, I have it. We all have it, right? But it's like you've got to attack some of those other areas because that, I think, clinically is how I get better outcomes than most. And because I can spend a little bit more time with my patients because I open my own practice to do that. And B, looking thoroughly at those other areas, it's like that's the keys to the kingdom. Like, man, we got to fix this, and this. When we do, you're going to be good. Period. Or if you're not, then I'll know sooner than later. I'm not going to mess with your time or mine, and I'm going to get you to somebody else that'll kind of get you the answer. I don't get everyone better, of course, but 99.9. No, I'm just kidding. Yeah. So, good question. Yeah. Any other questions? Everyone's been very attentive. This has been good. Yeah. No, my pleasure. My pleasure. Good. And like I said, if I can help anyone individually, specifically, if I don't hear from you, you'll hear from me.
I had to have a question.
Yes.
You gave us ways to sleep on your back. If you do have trouble sleeping on your back, do you recommend a position sleeping on your good side for pillows or props or anything for your?
Yeah, to really kind of avoid the involved side, to avoid laying on the involved side, but you can't sleep on your back.
Yes,
Is that what you do?
if
Okay.
If you are
Yeah.
just, I love to sleep on my right side. I mean, my right side and my left side is my hurt one. Do you recommend pillows?
Oh,
or anything
okay.
to help
Okay.
put it in that position if you are on your side, on your good side?
Are you, so I'm assuming you're asking because the left shoulder hurts you when you're on your right side.
It doesn't hurt so much if I'm not on it, but
Okay.
is there just a position you recommend more to give it that
Reprieve.
reprieve that you were talking
Yeah.
about, putting it in on the back?
Yeah, on the left, if your involved side is your left side and you're laying on your right, prop, some kind of prop underneath it, and then, can you prop it and have it stay on your side? Can you prop it and have it cradled over something a little bit in front of you? Certainly, I don't think behind is very unlikely going to be the winner, but either on the side propped or
Yeah, I cradle mine over.
you cradle yours over, yeah.
Yeah, just put it over pillow Allison.
Yeah.
I went to high school with her.
Oh, okay. Oh, great. Oh, yeah.
You've been to
That's
sleep
what I do.
Sleep over. Yeah, right. Yeah.
back in the day.
Yeah.
I start off, as a side person, but I always wake up, with a cat on my chest.
Okay,
So I
yeah.
always wake up on my back.
On your back,
Maybe
okay.
it's the cat, I don't know.
Yeah.
That's how I wake up, but going down, it's just, this side, trying to get a good.
Comfortable,
spot.
yeah.
I find that I do drape it over a
Just a pillow.
Pillow,
So
yeah.
you kind of get the same position as if you were on your back. Okay.
And some of it is really honestly just like playing with it, being aware. I mean, obviously, that's fairly intuitive to most people. Like, oh, let me try something different. You'd be surprised, though. Some people aren't aware of that. Of like, oh, let me just adjust and let me just change. So play. It's not a one size fits all. Play with it a little bit and see what works. Yes.
Do you suggest cold or hot? I've been putting a heating pad at
Uh-huh.
night, but
Mhm.
I haven't done anything on cold.
Cold, yeah. Some people hate cold. And even if I told them cold would work, they'd be like, I'm not going to do that. Heat, like Jeff's question, heat helps with the muscles around that area and reducing some of the tension in those muscles because heat will increase blood flow, it decreases muscle tension, and it reduces pain. So heat And as a general rule, the more chronic the condition, if it's been chronic by definition, is just anything longer than 3 months that it's been lingering. Heat, I like to try heat as that kind of first approach, because really if it's super chronic, chances are there's not necessarily like a really raging inflammation that's happening. It's probably more of a lower level inflammation. If there's inflammation and it's more like an acute injury, I've just fallen on it and there's maybe some swelling, ice would be more indicated there, because that's going to reduce swelling, it's going to reduce pain. It's going to make you cold, but I don't know if that answers your question. Yeah.
Absolutely.
It's kind of, and then really, as long as, if it's like huge and swollen and red already, don't put heat on it, because that's going to exacerbate it. That's probably your hard and fast rule. If it's already really mad, don't make it more mad with heat. That's, yeah.
And heat's good every night for a while, like, I mean, not all night, but like for.
To try to reduce it enough for you to be able to go to sleep? Yeah. Yep. Sounds like I have some candidates. Yeah. But no, I appreciate everyone. Take advantage, please reach out. If I can be of assistance to you specifically, let me.
Thank you.
$20.
Do you have a certain pillow you recommend?
Man, that's a great question, man. That is, I don't. I sell a couple.
One of those curvy.
Yeah.
Long.
Yeah.
So I don't know. I used to get cricks all the time.
Some of the support in your
And
neck
then, there's a lot going on in my neck, which is,
can be a contributor, yeah, for sure. Because, I mean, part of it, like we call a differential diagnosis, like just because you have pain that's in the shoulder or the upper arm region doesn't mean it's a shoulder problem. Could be a neck problem.
Mm-hmm.
That's referring pain to the shoulder. So,
that had gel in it.
yeah,
I
that
don't remember what
Dormeo, it's like some kind of
Dormeo or
crazy,
something
yeah.
like- I've had, it's been really good.
Has
I've
it?
enjoyed that.
Yeah, I've got a
It's
couple.
only offered.
I've got a couple pillows at my office that I sell. I mean, I've tried them both. I like them, but I don't really have an active problem, so I just like my little floppy pillow that I always use. I say don't go out and spend $1,000 on a pillow. Play with something that's a little different than what you have. If you're not tolerating a big fluffy one, get a little thinner one. Try that first. Spend $20. Don't go out and spend $1,000 first. That doesn't make any sense. So really the answer is not really, but play with it and see what works. And most people have with pillows, right? I've tried like 10,000 pillows. Yeah.
There's a new one for Christmas, and it's called the Coop, C-O-O-P. But they say it's supposed to be high enough where it keeps your head level with,
Neutral neck.
Yeah,
Neutral neck, yeah.
So it's a lot thicker than what I'm used to, so I've been trying that too. So.
Okay, yeah.
All kinds of
Yep.
I have a memory foam pillow, and I was like, oh, this is going to solve all my problems. But then by the end of the night, I'm like, my neck has gone like this because I've sunk into the pillow.
Yeah.
So, yeah, I've tried a lot of different pillows myself.
Yeah.
So.
And it's all like individualized. Like
It is.
one
Yeah.
person loves like high ball pillows and one does not.
Mm-hmm.
My husband got a nicer pillow than I do. I got the like floppy.
The just floppy, yeah.
More friend, and he got like one from like memory foam with the nice looking
Yeah.
the curves to it. He hates it now.
Yeah.
What a new pillow, and we invested a good chunk of money to it, and he's like, let me get your pillow.
Right, yeah. It's kind of funny how that works, but.
my husband has 5,000 pillows.
Mm-hmm.
My husband
Yeah.
has that floppy old pillow.
Yep.
Very attached
That
to
is
it.
his pillow.
Uh-huh.
I'm
Yep.
the one with 1,000.
Yeah.
I have a pillow fort if I wanted to build one, and he's like, I hate all these pillows on the bed.
Yeah. That's funny. Okay, you're welcome. Yes, grab some food, take a drink with you.